Today also record-breaking for COVID-19 patients in standard and intensive care hospital beds, as well as on ventilators. The numbers are one thing, but tonight we talked to a woman who knows the struggle in our hospitals all too well. A nurse on the front lines every day, painting a dire picture of what's happening in the state's largest hospital system. Patients transferred between facilities to keep ever-rising capacity under control, and warning others if cases don't go down soon, Arizona hospitals will be stretched to their limits. ABC 15's Cameron Polam with her emotional plea.
We are at capacity, and looking forward at the next few weeks, it's kind of scary and daunting.
A Valley intensive care nurse turning to a video blog, sharing her experience on the front lines inside Banner University Hospital.
You feel the emotion of it every single day. You feel the stress of it every single day. That means the instant that you walk into the hospital, you know you're probably going to be short-staffed, and you don't know how many people you're going to get.
Melody Nungaray Ortiz works with a team who put COVID patients on ECMO machines, apparatuses that act as the patient's lungs, a last resort for those hardest hit by the virus. Only 50% survive.
We are on unstable ground. We are doing everything that we can to run on bare bones so that we can have enough nurses for that oncoming patient.
As of Sunday, Banner Health is caring for 584 patients with COVID at 15 locations across the state. Banner University alone has 111, 30 of which are on ventilators.
All of our beds are full. Additional emergency rooms are being opened.
In order to handle the influx of patients and the extensive care they need, nurses and other support staff are being brought in from places like New York. Their experience and attitude a lift for those fighting every day in our community.
God, you see the fortitude in them, and you want to emulate that.
But eventually these folks go home, their families waiting, emotionally drained. They push on the best they can.
I can't show my kids how sad or scared I feel sometimes. I can't share with them my stories. I have to not let that show.
Despite that effort, her oldest son approaching her the other day after watching the news.
He broke down crying, and I asked him what's going on, and he point blank said, "Mom, I don't want you to die."
She's now begging the community to act responsibly, socially distance, wear masks. Every action could be all the difference.
Do we know if we're going to have enough hands to save everybody? I don't know. Are we going to have enough dialysis machines for everybody? I don't know. There's a lot of unpredictable factors that we haven't been able to problem solve because there's no one way of nailing them down.
I'm Cameron Polam, ABC 15, Arizona.